Hi guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee, espresso shot. Okay guys, this is another true story. Whoa, I'm losing my little my phone here, so I'm gonna hold it. Okay, so here is another one of our text message reads from a nurse. Hey, there's a urine specimen collected again for this patient because we thought we lost the first one, but the second one shows greater than 100,000 colonies of gram-negative rods. Any orders? And I said, well, what does it say she's sensitive to? Because I always order a sensitivity with my urinalysis if I'm thinking infection. So she said, I don't know, it's still pending, but this is from last week, and she's confused. Can she get something? So I gave her an order to start the patient on antibiotics, but I don't really like to do that because I don't know if the patient's going to be sensitive to it. So I said, please call the diagnostics company or the lab and follow up with them and ask when is this sensitivity going to be back, so that way we can have her on the appropriate labs. And give me the rest of the assessment for the patient. Can you provide me with vital signs as well? Well, I'm just following up on the lab. I don't really know the patient. Yeah, that's what was said. I said, okay. I said, well, thanks. However, you are the one who is contacting me about these results. So I need you to go and assess the patient and get back to me with the information, please. If not, send my patient to the hospital. She comes back and states that the DON says that there's no reason for this patient to go out to the hospital, and that the DON said that they would start the antibiotics. So I stated that the order is rescinded. I'm not giving an order until I get the assessment for the patient, and if that's not done within the 30 minutes, my patient is to be sent from the hospital because these results indicating infection are from a week previous that you've just now reported to me. So, of course, this is one of those situations. I got a call from the director of nursing who states the patient doesn't need to go out, and states that that they got 2 different urine specimens and they've got results for both of them. So the issue is here, she doesn't want to send the patient out. But I told her now that she finally gave me vital signs, and then I found out that those vital signs were actually old, but it was already indicating that the patient was septic. So I said, we cannot keep this patient in the facility because at this point I can't trust anything that's being said, and it's not in the best interest of the patient. She's had this issue going on now for some time. So please send the patient to the hospital. I don't think that there's anything that we can do. You don't have anyone that can put in IV or anything like that, and then we can't get really another stat, like a stat urine collected, and we still do not have the sensitivity. So I don't even know what I'm working with. So in short, we ended up sending the patient to the hospital, and I was correct. She was septic, but in conjunction with being septic, which I believe was probably started from the urinary tract infection, she also had pneumonia, which she didn't really have any symptoms of that were reported to me anyway. So it was a good call to send her out. And then there's other times that I've sent patients out that they were sent right back, but I'd rather be safe than sorry. So nurses, what we have to do, we have to make sure that no matter who gave us the task to report things, you have to go and assess the patient yourself, collect some information and find out. We got to do our due diligence, guys. So it's been NP Clark, your favorite nurse educator, with another espresso shot from the morning coffee.